and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗁 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗁 on 𝗛𝗏𝗰 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗁 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗁. I'm your host, Nicole Jacinto. Before we start the show, I'd like to say hello to Kyla, who will watch from Honolulu, Alessandra, who's watching from the UK, and to Ladybug, I guess that's her, her nom de plume, who is watching from Madrid. Okay, so, folks, last week we talked about kidney care, and this week it's actually kidney care part 2, but we're going to focus on kidney stones, and we have here with us one of the best guys in 𝗏𝗏𝗁, one of the best doctors who treats kidney stones. We have Dr. Stephen Nazareth with us. Hello, Dr. Nazareth. Welcome back to the show.
Hi, Nicole. How are you?
I'm okay. I got sick a couple of weeks back. That's why you saw me drinking some cough syrup there. Still have some effects, but I'm doing fine. And just like to remind people to take care of themselves because COVID is still out there, and so are other illnesses. And today we're going to talk about kidney stones. I had you as a guest a few years ago, Dr. Nazareth. You're a urologist,
Yeah.
so this is your expertise.
Yes.
People go to you for this. And by the way, you're looking really good, doctor. It's good to see you.
Thank you.
It's good.
COVID has been good to me.
COVID has been good to you. Okay. Well, yeah.
Yeah.
Really? Okay. You got it too. Well, that's a private question. You don't have to answer that. Okay. So kidney stones, Dr. Nazareth, can you tell us exactly what kidney stones are? What are they?
Okay. In a nutshell, kidney stones are basically stones on your kidneys. Okay. So these are they start off as like sand that slowly develop into stones, and they get stuck in your kidney, causing like several problems.
Yes.
But most of them you only find out if you do get a checkup.
Yes. Okay.
Kasi hindi naman all of them would start off as you developing pain or something. All of them would start off like small lang, and then they're just there. You don't feel anything. No. The only way for you to find out is if you have yourself checked up.
So Dr. Nazareth, you describe kidney stones as like sand, and it's like it's I guess it's material or calcification or whatever it is in our bodies that it's sand that sort of groups together.
Yeah.
And then,
It's like yung pearl. Diba? You start off with a speck.
Yes.
And then they little by little they grow kasi other sand they develop, they envelope it, becoming bigger and bigger and bigger. So that's how it usually starts, with a speck of sand.
Oh, if only we could harvest pearls from our kidneys. Well, that's not a good thing either.
Yeah.
Okay. So, that's a great picture of how it forms. Thank you for telling us again about for telling us how kidney stones form as well. Starts off as a speck of material that shouldn't really be there or shouldn't remain there.
Yeah.
Then it grows little by little, and most of the time you're not, well, as it's happening and when it first starts off, you're not really aware about it. Doctor, can I ask you, okay, what causes kidney stones, I mean, are there any genetic factors or predispositions for individuals to develop kidney stones? Don't worry, we can circle back to other questions later.
Yeah.
Basically,
Uh-uh.
is it age also? And basically, can you give us like a general profile of someone who might be predisposed to getting kidney stones? Whether it's age, gender, blah, 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 or anything genetic.
Okay. Um, mm. Men are more prone to develop stones than women, okay? Like
Okay.
3 times more prone, because they usually attribute this to lifestyle.
Okay.
Because supposedly men like to drink more, tapos more alcohol, and men love to eat more. I mean, more uric acid,
As they're drinking the alcohol.
and they don't like to drink water. Yeah, of course, if you see more than just one member of the family, or you see it younger patients, you think also of genetic predisposition.
Okay.
Is there like a member of the family who has it as well? Okay. So, yun yung mga basic anong ganon. And then, but most of them, unfortunately, happens for no particular reason at all.
Okay. So, like, no particular reason at all. You just find out that you have kidney stones. I mean, basically, a lot of factors. You can't really say. I mean, please correct me if I'm wrong. What I'm getting from this is that you can't really say that just because one member of the family has kidney stones, therefore you are predisposed. And perhaps it's also environmental, because you kind of like maybe eat the same stuff or have the same habits or whatever it is. Yes.
Oh.
Yeah.
Actually, that's the contestant there. Yung it's not genetic. It's mostly because you eat the same food. You are exposed to the same stuff.
Go on the same bars. All right. I think we just have we'll wait until we can hear the sound again from Dr. Nazareth.
Yeah.
Yeah, okay. Sorry, Dr. Nazareth. I don't know if it's you or me who cut out for a while, but I didn't hear your answer. When you were saying stuff. Okay.
Yeah, sorry. Bad connection.
Okay.
Must be mine. Must be my end. So usually, if for example, more than one member of the family has it, the question there is it really genetic, or is it because you eat the same food, or you expose to the same thing? You will have if yung idea, if for example you get it younger, like 20s or even younger. I doubt it if sobrang malas naman if it's just because of the food you eat.
Yes.
So chances are this might be more associated with genes.
Genes.
Or if, for example, yung sobrang taas naman ng occurrence, like your parents have it, like your brothers, or almost everybody has it, then chances are this is really genetic.
Then your cousins have it too, that kind of.
Yeah. Exactly. Na hindi naman not in your household,
Yes.
So yon. But otherwise, ang doon is they are more likely to believe that it's because you are exposed to the same thing, not necessarily because of your genes.
Yes. Okay. Thank you, Dr. Nazareth. Also, you mentioned that it occurs more often in men. You mentioned drinking. Can you tell us why? Well, we can circle back to these things also later when it comes to diet and all of that. But just people say, why drinking again? Why drinking again? And all these things. And are there certain drinks that are there certain types of alcohol that are more likely to kind of predispose you to get kidney stones? Because Snapper people will say, of course I've heard this, like, no, I'll drink vodka because it's not, I won't drink beer because it's this, or, or I'll drink scotch because of that, or, oh no, I just drink wine, it's supposed to be healthy. Is it all types of alcohol, or are there some that are more, how shall we say, suspicious than others?
Well, yung what do you call this, yung mga galing wheat, di ba? There's like wheat beer or
Yes.
ano ganon.
Yeah, beer,
So,
yeah.
yeah. So it contains apparently more uric acid kasi.
Okay,
And
yeah.
the problem kasi if you drink alcohol, in general, alcohol, you tend to pee a lot
Yes.
to the point that you get dehydrated.
Yes.
So, you become dehydrated. Yung mga particles ngayon, they easily clamp up together.
When you're dehydrated, the particles easily clamp up together.
Yes.
That is
Kaya nga, oo, kaya nga you always hydrate eh.
yeah.
Para you keep on peeing, para yung mga sand, they don't they don't find each other.
Yes.
So it goes to your urine.
Yes.
Now, another problem with yung drinking is mahilig tayo sa pulutan.
Yes.
Okay? And of course, our pulutan, it's like meat, salty, yung mga yung uric acid, these are, okay? So they add to your possibility of forming stones.
Yes. Yes. Okay. So got it. I mean, I've been, of course, I'm guilty of this myself in the past. Like, I'll tell. This is okay. I'm not advising the public to do this, but I have told those friends, like, I think you should double fist it, meaning like you're drinking that glass of alcohol, you should drink another glass of water. And yeah, you're right. You do tend to pee a lot when you drink. And you do get dehydrated. I'll reveal a secret about me. It's not really a secret, but something personal. I had a friend. Oh, she's still a friend, and I actually chatted with her the other day. When we were in college, we made a bet. We would see like if who could drink 10 beers without going to the bathroom. I don't think one of us ever won it. I mean, because you end up having to pee after a few beers. Okay. I think we'll just wait for the connection to solidify once more. Hello, Dr. Nazareth. Okay. We have some. Okay. Why don't we take? So on that note, with alcohol and the pulutan, Dr. Nazareth, if you can hear me, you're actually a bit frozen. So if you have,
wait. I'll find.
Oh, you'll find a spot for me. Okay,
area.
Great. Okay. This is great. I love this.
Sorry.
Oh, don't apologize. It's okay.
Right.
I mean,
all right. Here we go.
If we were both in together right now in the doctor's office or whatever, now we're consulting you and it was noisy somewhere, you said let's find a spot, it wouldn't be a problem at all. Okay, so thanks, Dr. Nazareth. Okay, so yeah, so
how are we right now? It's kind of dark. It's kind of dark right now, but hope you can bear with me.
That's fine. You are emitting light from your being, as you always do. I remember you're a very fun guest on and off the air. You have a great sense of humor. And you're very, very kind to your patients, because I know someone who went to you. So don't worry about that, Dr. Nazareth. Okay. Actually, before we talk about the kinds of kidney stones, we do have to take a short break. So folks, get settled. We're going to get into it, because I'm going to ask you so many questions, Dr. Nazareth. But you know me already, so you know that all those questions are coming. Okay, so we'll just take a short break. Stay tuned to Healthline with Makati Med to learn more about kidney stones, how you might get them, and how to avoid getting them. And if you have people whom you know or love, and this would be a great show to tell them to watch, and you can watch it over and over again online. But we're just going to take a short break. We'll be right back. Thanks, Dr. Nazareth. Stay tuned to Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗠𝗸𝗁𝗵𝗹𝗁. Available for outpatient care services, our 𝗠𝗸𝗁𝗵𝗹𝗁 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁𝗵𝗹𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁𝗵𝗵𝗃 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁𝗵𝗃.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
That's right. You're back with Healthline with Makati Med live right now. But remember, you can watch us anytime. We're streaming on different platforms, and you can watch on any device. And you, of course, listen on terrestrial radio. A lot of people still do. So hello to all the listeners out there who use radio. I love you guys. Okay. So, Doctor, we're talking about kidney stones. You told us how they form. Great picture of how they form. You gave us information about how maybe it's genetics but mostly environment, and how living in the same household, having habits and all of that, the same habits can lead to it. Now, doctor, can you give us an overview of the types of kidney stones? Because we'll hear something like distal, and then
Okay.
Yeah.
Okay, those are actually locations, no?
Location.
Kasi the urinary system is most of your upper urinary tract and your lower.
Okay.
Now, your upper is from your kidneys.
Mm-hmm.
It goes down to your ureter.
Okay.
Now, it goes down to your urinary bladder. That's your lower.
Okay.
Yes, lower before it goes out to your urethra.
Urethra.
No? And then, yung ureter, you divide that into your upper and your middle and your lower.
Okay.
That's why you can distal. So that's why you have your upper stones or middle stones or distal stones, okay? And bladder stones. Or they get confused sa bladder stones because we have two bladders. The gallbladder and the urinary bladder.
Oh yes, the gallbladder, urinary. That's right.
Yeah.
Okay.
Gallbladder not my specialty.
Not your
Okay.
urinary bladder.
General surgeon yan.
Yeah.
General surgeon yan.
Yes.
Okay, it's the urinary bladder that is associated with your urinary stones.
Okay. So doctor,
Yun. So it's just a matter of location.
location. Okay. So distal, that would be located in the lower urinary tract,
Yes, near the urinary bladder na yan.
near the bladder. Or okay, and then
Yeah.
if it's in the upper part of the kidney, what do you call that? Just out of curiosity, what kind of stone is that?
Okay. Yung sa kidney stone, if it's in the kidney, we call it nephrolithiasis. Kasi nephro means kidney.
Yes.
Okay. Now, these are the locations, but that's different from the types of stones,
Yeah.
Kasi there are several types of stone.
Oh, could you tell us about that then? You have different types.
Yeah.
Yeah.
Sure.
Okay.
Ayoko nga.
Ayaw mo. Sige, wag na lang. Oh, sige. After this question.
Okay.
Tanungin kita ulit.
So, no. Sige. We have, the most common kasi is calcium stones. Okay? Yung calcium, of course, it is attached to something else, It's not pure calcium lang. It is calcium phosphate, calcium oxalate, yung mga ganun. Depends yung they don't come alone, they come in pair. Yun, depende doon sa what they are paired with. Okay? And then, yun yung pinaka-common, yung calcium stones. Now, another more common is the uric acid stone. Ito naman yung mga food that yung stones that are yung very influential yung food. Kasi calcium is not much influential. Not so you don't need to stay away from food rich in uric acid for you to develop these. Okay? And there are pretty rare stones na hindi naman talaga common dito sa Pilipinas, like cystine stones, Yung struvite, that is doon. Ito yung stones na nagfo-form out of yung repeated infection.
Okay.
So, yes. So, the bacteria, the one yung parang sila yung nagiging focus. Okay. So, and then, nagiging struvite eventually. Yon.
Alright. Thank you.
Ito yung lumalaki ng gusto na nagiging yung staghorn. Usually because of yung doon. Yon, struvite, combination of calcium, struvite, sometimes uric acid. Kasi it's very seldom that you can see pure. More often, they are combined with something else.
Doctor, when we talk about infections, is it kidney infections or pwedeng UTI? Is those kinds of infections or
Okay. Yeah. Yung UTI is a general term. Okay. Infection anywhere along the urinary tract.
Anywhere along.
So, ang UTI ngayon could be a manifestation of a stone formation. Yung iba kasi, they keep on going back to the doctor because they have urinary tract infection. And then, when you work them up, kaya pala recurring yung infection because they have a stone. The stone now becomes a focus of the infection. Kaya pala hindi mawawala-wala yung infection niya because there is something causing it.
Yes, there's something causing it. Okay, great, doctor. That's such great information. And then more often than not, we'll hear of women getting UTIs more often than men. Now, is that because the female urethra is shorter, or is it just because women attend to it more? Do men get UTIs and like, oh well, I'll just drink another? In your experience, like culturally, or medically, in your experience, when it comes to UTI?
Okay. In extremes of ages, the very young and the very old, men are more prone to develop UTI than women.
So it's a misconception that women.
No, yung during your early you can have yung UTI. Women are more common to develop UTI. Okay. So pero in extremes of ages,
Oh,
All right.
invasive.
Very young and very old. Okay. That's Dr. Daryl over there.
Hey, Dr. Daryl, what's
I
up?
share
Join
clinic.
us. Join us.
Uh,
Join us.
Join us daw. No, he's a
Uh-uh.
pulmonologist. Kasi,
Oh, sige,
ayun.
pwede rin.
Now, ano tayo, mag-set up tayo sa kanya next time, di ba?
Pwede, pwede.
Yan. Oo. Yung ano, no, yung stones, no, sorry. Yung, when you're very young, men are usually, the children are more, male patients are more likely to develop UTI than women kasi because they're usually uncircumcised. And sometimes nagkakaroon sila ng yung maliit, what we call phimosis, or yung iba yung hindi patagpos yung buko. Now that makes them prone to UTI.
Okay.
And yung elderly naman, because they're developing prostate problems, which may make them develop more UTI. Now, in between, which is practically our lifetime, women na yung more prone to develop UTI because the urethra is so near the vagina and the rectum.
Okay.
So because of the that area, so they kind of get easily mixed on ganon. But it doesn't mean na yung UTI in women are acceptable. No. They're just more prone to develop, but it doesn't mean that you have to accept it na lang. No.
No, you must treat your UTI.
Yes.
Okay. So,
and if it happens more than once a year, you have to investigate. There might be something wrong.
Right.
And one of the common causes of recurrent UTI is still stones.
Still stones. Okay.
Yeah.
Like, my stones are bigger than yours. Okay. Thank you, Dr. Nazareth. That is such great information. And if it happens more than once a year, okay. Thank you. Then just investigate it. I mean, so these are things we're learning. And can circle back to that also as a symptom later on. I have a very basic question. We call kidney stones, right? But as we've seen, they're not always located in the kidney. As you said, they can be in the urethra, in the bladder. But it's a blanket term. We still say kidney stones for everything. There's no other term. Like stone. Just out of curiosity.
Well, kasi if you want to be, halimbawa, yung sa amin, in medical terms, if you say urolithiasis, that's a general general term for stones anywhere along the urinary system.
Okay.
Now, if we want to be strict about it, kidney stones are on the kidney alone.
Okay.
Ureteral stones, yun yung nasa ureter, depends on the location, no? And then bladder stones or urinary bladder stones are in the bladder. So we have different terms for different locations.
Okay. Thank you, doctor. Just checking, because people might hear that, no, I don't have a kidney stone, but I have something else. And so it's just a general term we use, but they're still stones. And as doctors and a urologist like yourself, you will have the location down to it. You will have the technical terms and you will explain to the patient.
Yes.
The patient. But for our purposes of just learning more on the show and being aware, we're gonna say kidney stones. Okay, so, doctor. Okay, as a urologist who treats people with kidney stones, I mean, do you find that kidney stones can be like secondary to other illnesses?
Oh, that's a good one. That's a good question.
Generally.
Yeah. Okay. Now there are kasi yung diseases sa katawan that may make you prone to develop your kidney stones. One is if you have high uric acid levels, diba? Kasi if you have high uric acid levels, only 3 things can happen. 1, you develop gout. 2, you develop kidney stones. Or 3, you develop both.
Okay. Yeah. Okay. So gout is when your feet get swollen and the uric acid is kind of low.
Yes.
In your toes and Yeah.
Yes.
Okay. And then,
Mm.
so if you,
So, kasi same principle yun eh. You
oh,
develop crystals. Now,
yeah.
yung iba, they find their way into your joints,
Mm-hmm.
causing those gouty arthritis. And
Mm-hmm.
some find their way into the kidney. And
Yeah.
then they're the ones that slowly develop into stones.
Mm-hmm.
Yan. And then there are other illnesses, yung tinatawag natin yung hyperparathyroidism. Now,
Okay.
yung parathyroid gland kasi ito yung thyroid is our goiter.
Okay.
Now, ito here. Now,
Yeah. And then
underneath that,
under,
there are pinpoint organs we call parathyroid glands. Now, sila yung responsible in maintaining the calcium level in your body.
Mhm.
Now, sometimes if they overproduce,
Mhm.
you overproduce calcium. They
Okay.
now become of infection, infection of stones.
Yeah.
Over production of calcium in the blood
Mhm.
may make you develop kidney stones, yung calcium stones.
So then, like you as a
Yun.
urologist would be, if you discover this, you'd be working with an endocrinologist who is it an endocrinologist?
Yes,
Yeah. Who? Okay. So then, yeah,
endocrinologist.
endocrinologist who.
And
Mhm.
yung iba naman is if there's something wrong with your body.
Mhm.
Now, halimbawa, there are yung yung hindi maganda yung emptying of your urine.
Mhm.
Like if you have like strictures somewhere along your urinary system,
Mhm.
normally between the kidney and your ureter, may
Mhm.
stricture doon. So your urine doesn't really empty well.
Mhm. Okay.
You can develop stones from that.
Yeah.
Yon. And then, halimbawa, if you're not emptying your urine well in the bladder, you
Mhm.
can develop stones in your bladder. Yon.
Yeah.
This is anatomic, something wrong with your anatomy.
Okay. Yeah. So there's something.
Mm-mm.
Sounds okay. Thank you, doctor. And like, when you talk about also like not emptying your bladder, I mean, sometimes it's also people's habits, like they rush, no, when they pee, but
Mhm.
um, and so parang they don't completely pee everything out, you know.
Yeah.
So you'll get,
Mm-mm.
or it could be that there's something anatomically wrong. So
Yeah.
I just have to be more like, uh, learn ways on how to pee more. But there are other people. Do you fix things that are anatomically wrong with with someone sometimes? Like let's
Oh,
say,
yeah.
yeah, you do, okay, through surgery
Yes.
also.
Mhm.
Okay. Yeah, I won't get into that so much, but
Yeah.
I was just wondering if, like, it's secondary to something else that causes it.
Yes.
Okay,
Mm.
okay, doctor. So
Yung, actually, Nicole, if I may add, it's very important kasi your question is very important. Na, kasi if for example, you treat the stone, it keeps on coming back, you have to find out why it's coming back.
yeah,
Does he have, kasi you treat that stone, but you need to treat the medical problem.
yeah.
Otherwise, the stones just keep on coming back.
Yeah. The stones could be a symptom of something else, right? And I mean, you need to
Yes.
treat what exactly is wrong with that. Yeah. So you need to be
Yes.
folks, I'll tell you, if you go to Dr. Nazareth, he's thorough. I haven't been to him myself, but I know someone who went to him, and he's like, I don't even remember this person, but I know you were very thorough. And then I think I spoke to you on the phone, and you know how I am. I get very thorough as well. You're like, yeah, sorry, Dr. Nazareth. Okay, but
No problem. No
okay.
problem.
Okay, so Dr. Nazareth, can we, like, what are the typical symptoms that an individual who has kidney stones might experience?
Mhm.
Yeah, we could go there, like, talk about the symptoms.
Oo. Okay. So, we go from the asymptomatic, these are the people who do not feel anything, to the symptomatic ones, okay? Most common visit kasi, nagpa-urinalysis sila and they saw blood in the urine.
Okay.
And they cannot figure out exactly what's going on. This is nothing that you can see by your eyes. It's only urinalysis that sees that you have a bit more blood than the usual.
Mhm.
Then you do ultrasound, lo and behold, ta-da! You have a stone.
So, yeah.
So, sometimes naman, it's not blood, but it is pus in the urine. Okay,
Yeah.
you always have UTI, ganon. And then do ultrasound. There you go. You have a stone. Okay. Now, if naman you go to the symptoms, the most common is pain.
Yes.
Yan, on your side.
Mm-hmm.
Now, this is not just yung usual na, doc, I have this nagging pain or ache that's there. No, it's not that one. We're talking about the pain na you will rush yourself to the emergency room because you cannot bear the pain.
So it's unbearable if it's a kidney stone and it's
yung yes, typical description of my patients, you feel like right there and there you're going to die.
okay.
from the extreme pain.
Mm-hmm.
I have I have patients who gave birth
Mm-hmm.
and who develop stones.
Mm-hmm.
They would much rather give birth than to a child than give birth to a stone. That's how painful it could be.
And doctor, when you talk about pain, okay, let's go first to the asymptomatic. So you find out because you get a routinary and urinalysis or something. Diba when the lab test comes out, you can see like RBC, like, oh, there's red blood cells.
Yes.
I don't know, 1 or 2. And then you can see pus or something. And then, there's like there's a range, diba, that's acceptable or whatever it is.
Yes.
And then, so these are the things where somebody's not feeling it, but you're like, oh, why is there blood pala there? And you can't also see it. So,
Yes.
so the urinalysis is important also. And a lot of people skip it because they're like, don't want to hear and ever, I'll send you my pee, then you never go back and give the pee or, that kind of thing. So those are the things that are atypical because they're not feeling the pain, the symptoms,
Yes.
but you can see it in a test in the urine.
Yeah.
And is it when it comes to the tests, is it acceptable like when it comes to the range, of the blood, or you'll see something there like epithelial cells, which I is skin, or I don't know, or
Yeah.
yeah. Okay. So, I was correct. Thank God. Okay. So, is it normal though to have like maybe not normal, but because I know people who have like, oh, it said I had like a couple of blood, a little bit of blood in my urine and some pus and but I, okay lang daw yon. Parang
Yes.
so there is a range and
yes. Kasi like I keep on telling my patients, it cannot be 0 every time and all the time.
yeah.
That's why there is an acceptable range.
Yes.
Depends on the laboratory. Like here in Makati, it's like 0 to 2 or 0 to 3. Yung iba, pwedeng 0 to 5 is still considered normal. But there will always be a range. Beyond that, that is the one that we investigate.
Okay.
But if it falls within the normal range, it will pass as okay, those normal things.
Yes. And ladies, just a reminder, tell your doctor if you have your period because obviously you might have some blood mixed up with your urine if you and then you're like, oh my God, I have so much blood there, but you can't. I don't think you should really do urinalysis when you have your period. I mean, that's not the problem. That's just my advice. I don't. You can tell me, no, that's fine, Nicole. I mean, please jump in anytime and correct me.
You can naman, but
you can.
It does make a lot of preparation, no?
Oh, yeah.
You have to wash, and ganon. Basta tapos immediate yung there are instructions. It's still possible, pero if you see blood, it's still a bit less reliable because you know that the patient has her period.
Okay. Yeah. Okay. Thank you, Dr. Nazareth. And then when it comes to the symptoms that you mentioned, it's usually pain. And you did describe the pain for us. It's unbearable. Now you said it's usually pain on the side. Is it on both sides or one side or depending where the stone is? And can you describe also for our listeners who are listening on radio and maybe some of them are blind, they don't see. can we describe like what part of the side exactly? Upper part, under the ribs,
Okay.
by the hip?
Yeah. Depends on the location, ano? But in general, it's on your side, just below your rib.
Okay,
Okay.
on your side, just
So
below.
just below your rib, on your below the rib. And then sometimes it travels, yung what we call radiating pain, ano?
Yes.
To your back,
Yeah.
sometimes to your lower abdomen, sometimes to, if it's a male, to the testicle.
Okay.
Okay? So, yon. But it does not travel sa hip or sa thigh.
Okay.
So that's different. That's why when the patients complain of thigh pain or hip pain, chances are this is something different. I'm not disclosing the fact that it's no longer a stone, but
Yeah.
less likely a stone.
Yes.
So, yon. Yung isa pa is yung mga low back, yung mga
Yes.
lower back. Sabi, my back hurts. They almost always associate it with the kidney stones. Normally, it's not.
Normally, it's
But
not.
some kasi they overlap eh.
Yes.
Kasi yung unlike yung sa skin, when you pinch somebody here sa skin, you know for a fact that it's there. You're being pinched there. Because the nerves of the skin, it's very specific. Okay,
Like it's
nandito
my
lang yan.
It's my arm.
Yes.
It's my butt.
Unlike, yeah, exactly. Now, unlike yung sa inner, natin, yung mga, yung innards natin, organs natin, not as rich in, yung pain receptors as our skin. So, yung mga pain dito might manifest somewhere else. Kasi they share the same pain, yung pain, yung mga nerves. Yun eh. Kaya it
They share the
travels.
same pathways telling the brain that, hey, it's here. Okay. So,
But yung sa urinary system, basically the same yung pain pattern. Kaya a pathway. Kaya you know that if this is the pain, if this is where it goes, it most likely is a kidney stone. Yun yung tinatawag namin na renal colic. It's actually the colic. That's the pain that you feel because of a kidney stone.
Just thought of something, doctor. Let's say someone has lower. I know it's not the topic, but just quick, if we can quickly touch on it. Someone had back pain. They went to the doctor, said, okay, most likely muscular, but let's scan it. And turns out the person, cysts in the kidney. Are those, I mean, I know it's not the topic, but just to quickly touch on it, are those dangerous? Because, the things, you'll develop more cysts as you get older, and we're gonna if you want them removed, we're just gonna sort of alcohol in them. So what's the use? If you have cysts in your kidney, are they somehow, or in your kidneys, are they somehow related, or can they make you more prone to get kidney stones?
Okay. Yung cysts, these are just yung collection of fluid in your kidney. That 70% of the world population have this.
Okay.
So it's nothing out of the ordinary. It's not gonna, unless it's too big. That's causing a problem. No? Otherwise, you just observe it. Yeah, you see if it's getting big fast or it's multiplying. But normally, don't do anything about it.
Okay, and then if you have,
and it will not make you form stones. It will not make you prone to develop stones.
Okay. Thank you, Dr. Nazareth. It won't. Okay, good. Thank you, Dr. Good for, because a lot of people, I have cysts in my kidneys. Oh, me too. Ganon. But
dami, di ba?
Yeah, we don't have to panic. It's not gonna make you form stones. It's just like fluid collection. And I was told, they said that if they're just it can come back. So the person chose to just let it go. Yun. Okay.
Yeah.
Okay. Thank you, Dr. Nazareth. Okay. Now, can someone, okay. You already said that somebody can experience pain, it's like referred pain or like from having kidney stones, not just on the side, but you mentioned the areas already. Like it could be like the side going to the lower back, or the stone is moving. But as you said, if
Yeah.
it's the hip or the thigh, it's usually not it. Like you can
Yes.
feel lower abdomen. Okay. So thank you for letting us know, doctor, because maybe it's helpful, because when you start getting pain in different areas, and as you start thinking, I might have this, I might have that, but
Uh-huh.
and then, as you said, if it's a kidney stone that is giving you pain, um, patients tell you they feel like they're dying. So
Yeah.
it's so
Yeah.
it's probably just a dull ache or something.
Uh-huh.
It's probably not a stone, and maybe you're just like, I don't know, your posture or whatever it is, or yeah,
Mm-hmm.
doctor.
Yes, that's very
Okay,
true. That's very
yeah.
true.
Okay. When it comes to, say, discovering kidney stones or checking if someone has kidney stones, for a urologist like yourself, do you get patients who just do you get a lot of patients, like in your practice, in what you've experienced, who just walk in and say, I think I have a kidney stone? Or do you get like referrals? How do like how do you like kind of find out, or how do patients find you usually? Because people will not
Oh,
they think they have kidney stones
uh
unless they're dying of pain, right?
okay. Kasi most of my patients
Mhm.
still are referrals from other doctors na they're being worked up for something, and
Mhm.
then they see another yung incidental finding lang talaga yung kidney
Ah.
stones. That's why they refer the patient to me. And yung iba, it's very seldom that you would see a patient na they would do instantly ultrasound and
Yeah.
go to you, doc, I have this. Ganun.
Mm.
So yung others, well, it's a good thing that nowadays medyo health conscious na a lot of our patients, no? So they do get their annual physical, ultrasound, and then they themselves go to the doctors. But
Mm.
most of my patients referrals talaga from other doctors, or they just came from the emergency room because they had pain,
Yes.
and
Yes.
then they were given pain medications, and then previously sent home, then came to me for follow-up.
Yes, yes. Okay. Just
Mm-mm.
curious about that, because as you said, it's atypical, they don't know. Then as you said, they discovered something in the urine. They investigated it more, or
Yeah.
like, for you first you go to a doctor that you usually go to, or the ER, and you're like, I'm dying of this pain. And then that's when you
Yeah.
come in. Okay. But as you said, we are getting more health conscious. We are getting more checkup,
Mm-hmm.
not just and it's good. It's good for our culture. It's good for the country to do that.
Yeah.
Not to totally overdo it, but to check up on ourselves, and I should really get another checkup. But but also, I mean,
Okay.
I it's something that, see, at least it's on our mind now, because
Mm-hmm.
for many before, it was really, I think, until recent years, it's like, I'm not gonna do anything unless it's like crisis mode already, and we
Mm-hmm.
still retain a lot of that. But thanks to more awareness, and I hope that, like, this show also raises awareness among those who are watching it. um I've learned so much from you already, just with the
Mm-hmm.
conversation we've had. And I'm going to ask you so many more questions, doctor, but we do have to take a short break. Folks, we'll be right
Sure.
back. Stay tuned, Healthline with Makati Med. And we're going to talk about diagnosis, treatment, and, this treatment that's available, that Dr. Nazareth uses, and it's available in Makati Med. When it comes to actually getting to those kidney stones that give us pain, that give us problems and other things. So stay tuned to Healthline with Makati Med, and we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗛𝗶𝘶 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access. Hi, this is Dr. 𝗛𝗶𝘁𝗵𝗹 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. We're here with the great Dr. Stephen Nazareth, and he's a urologist. So we're talking about kidney stones, and that's his specialty, folks. So Dr. Nazareth, you've already given us the symptoms of having kidney stones, typical and atypical. You've told us, you often find patients. Can you tell us, how do you properly diagnose a patient with a kidney stone? Like, what's your any clinical procedures or diagnostic tools that you have?
Okay, basic is still ultrasound, but unfortunately, the ultrasound can still miss yung location of the stone kasi there's this blind spot, along the urinary system, especially if it's in the ureter. It's going to be difficult for the ultrasound to see that. Now, our standard now, yung gold standard for doing yung diagnosing the stone is CT scan. It's what we call CT stonogram.
CT stonogram, okay.
So, so it's very fast. No, it's not. It won't even take you 5 minutes. Like 3 minutes, it's done.
Okay.
And it's very precise. We can tell you where the stone is, how big the stone is, how hard the stone is.
Okay, great. And you have
So that's the beauty of it.
Makati Med. Yes, you have this.
Oh yeah, we do.
Okay. And doctor, like,
Mm-mm.
so, if somebody, maybe you would get a urinalysis, do you do any blood tests as well, just to check, like, the creatinine of someone, that kind of thing?
Yes. It's very important to do creatinine because creatinine level will dictate the urgency of doing the procedure or waiting for it. Because if you know for a fact that this patient has a normal creatinine before and then it suddenly increased,
Yeah.
that means there's a bit of an urgency to deal with the stone immediately. Kasi to prevent the further increase of creatinine.
Okay. So creatinine, doctor, I'll just remind the folks out there, it's just a blood test that they'll administer.
Yes.
Get your blood, the lab will work it up. And of course,
Yeah.
if you say also in your analysis, you'll just pee, and you don't need to fast for that, diba? It's
No.
just, it's there. And then do you do like EGFRs too, or do you consider, before the ultrasound, if at all you do the ultrasound? And
Well, yung EGFR is usually part of they just additional test lang naman yun. It's when they get your blood test, they can compute for that.
yeah.
EGFR, that's a rough estimate lang of your kidney function.
Okay. So it's a rough estimate lang. So, okay. So if, let's say, somebody does the urinalysis and then the blood test for the creatinine can also be used, the blood can also be used to compute. It's just a rough estimate.
Yes.
And then like you see suddenly that, hey, the creatinine has gone up and the GFR somehow has gone down, and then
Gone down.
And then before, do you still use ultrasounds sometimes, or you just go to the gold standard if you want the gold standard with the CT scan?
Kasi if you have like high index of suspicion of ureteral stone, we're talking about ureteral stone, it's best that you do a CT scan na agad. So you don't waste time.
Yes.
You immediately find the stone and you know immediately what to do.
Yeah.
So
Why
kasi,
waste time and money on an ultrasound kung pupunta lang naman
ano naman?
diba? Tapos
Well,
yeah. Yung CT.
Oo. Actually, that will always be an argument. Because for me, I agree. Do CT scan, especially first time around. For follow-ups, definitely I agree with ultrasound.
Okay.
Pero yung first time, seeing a doctor tapos high index of suspicion, I would prefer sana CT scan eh. But yung iba, if you have like yung kidney stones lang naman, okay, ultrasound will be enough because we know for a fact that the ultrasound can see kidney stones. Or if it's in the urinary bladder, it can be seen. Na para, medyo if you're on the tipid mode, kasi a CT scan would cost like 5 times more than an ultrasound. So, they would do ultrasound. But personally, I would prefer sana yung first time is CT scan. And then yung mga follow-ups,
kung
yes,
saan.
exactly.
You can find the exact location, the size of the stone, how hard it is. So that you can see it better. Parang let's use the best tools na. And then for follow-up, pwede yung ultrasound. Okay. Thank you, doctor.
Yes.
Let's talk about treatments already for kidney stones. What are the different treatments you employ? Of course, there's the surgical where you remove, but there's also this extracorporeal
shockwave. Lithotripsy.
Can you say it again?
Lithotripsy.
Okay, so
lithotripsy.
ESWL for short. Lithotripsy. Lithotripsy. Okay.
Yes.
ESWL for short.
Yes.
Okay, so this is can you tell us about that? Let's talk about that.
Okay.
I know you use that
Sige.
technique. Okay.
Yeah. Yung long time ago kasi, if the patient does not get opened up, does not get an operation, common term is ili-laser natin.
Okay.
So that's why for the longest time, ESWL has been called laser.
Laser, okay.
Kasi Yeah. But nowadays kasi we really have laser na eh. No,
Yeah.
yung terminology lang just to
Yeah.
hopefully solve the confusion.
Yeah.
Yung laser kasi is light.
Yeah.
Shockwave is sound.
Yes. Okay.
So, yung shockwave lithotripsy is like yung just imagine a loud music tapos you're in front of it. You can feel, di ba? Boom, boom,
Yes.
boom, yung
Yes.
yung sound waves.
Speaker.
Now imagine, Now imagine concentrating that sound into a single focal point. Talagang napapaliit mo.
Mm.
So it can travel through your body and actually find your stone and pulverize your stone.
Pulverize
Okay?
it. Pulverize it.
Yeah.
I like that.
Well, hopefully that's what we're we're hoping for. Or at least break it into several pieces.
Okay. Are there some treatments where you can say, okay, let's just give the
Ano yan eh? Depends on Yung number one is the size. Now, if the size is 5 millimeters or less, okay, and granting the patient is not in pain or does not have UTI and all those, that no fever and anything, you can. There are medications that you'll be able to pee it out. And that's a 5 millimeters. And number two is the location. If it's in the kidney and it's not causing an obstruction, that's the key word there. If it's obstructing or not, you can opt to treat it. Okay, but if it's in the ureter and it's relatively big, ang hirap if you just give medication because it might not pass anyway.
Yeah.
So you might need to do something about it. Yan.
Sorry, before we have this technology of ESWL or what people would say laser, surgery agad yung gagawin.
Yes.
Yeah, okay. So you would like cut it open, take out the stone, and then pulverize it after or something.
Imagine. Imagine you have a stone this big. Yan, you have a stone this big long time ago, and you have a cut this big.
Yeah, so like the stone is as big as like less than a fourth of an inch, and the cut is about like what is
8 inches.
8 inches. Okay, yes. Yeah, because but then with ESWL or what they used to call laser, and I'm glad you clarified the terms for us. When did this technology come along? How long has it been around?
In worldwide around the 80s. But it did not get its popularity until like the 90s, late 90s. Here in the Philippines, like early 90s nandito na, but late 90s when it boomed talaga. Up to 2000s, here on, it's still But nowadays kasi we have other options, not just ESWL, but still ESWL is the least invasive.
Okay.
And that's why we still like doing the ESWL.
So ESWL, so let's talk about how invasive it is. What do you mean by it's invasive?
Okay.
Maybe you can take us through the steps of what happens when you actually like just a typical treatment, for someone who treat with ESWL. So they would go into a room or whatever, and then
a room where the machine is, we ask them to lie down. And then we locate the stone using either an X-ray or the ultrasound. It's built in. Ano yan? It comes together with the machine. Okay. It's either the X-ray or the ultrasound, no? And then there's like a bellow, yung small thing like that has the tawag doon. We fill it up with water and we attach it where the location of the stone is. On the skin lang, ha?
On the skin lang. Okay, so walang cuts.
Yeah, usually sa balat, sa backside. Now, and then we locate your stone, and then sound waves will be emitted through that machine, and that it enters your body. It emits sound like 1 every 60 seconds to 1 every second. Okay, That's why 60 per minute or sometimes 70, between 60 to 120 per minute.
Okay.
Na sound is tug, 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 ganun yon.
And you can
So
hear
it's
the
like,
sound also when you're going
oh
through
yeah,
you
you
can,
can,
you
yeah,
can
you can hear it. But not the patient, kasi the patient is like sedated. So
okay.
they're usually like, in between they fall asleep.
Mm.
Yeah.
Oh, okay.
And it's just like somebody flicking you at the back. Ganun lang yung ganun. Somebody flipping you. But
Parang small
yeah,
pitik.
but you know, yeah, pitik, pitik. But you know, like 4,000 pitik, it would hurt eventually if you're awake.
Uh,
Diba?
so you
So that's why we,
uh, what kind of sedation do you
mm,
use, doctor? Is it
ano, IV lang.
IV lang?
It's mild sedation, just enough to put them to sleep.
Mhm.
It's just like when you do your endoscopy, your colonoscopy, yan, fast lang. After the procedure, 5-10 minutes, the patient's awake already.
Yeah. I actually wake up during
Mm-mm.
endoscopies. I'm like, oh, and they're like, shut up, we are in your stomach.
Yeah,
And I'm like,
you're not supposed to be awake.
huh? I get so interested in the screen. I'm like, yeah, okay, yeah, but no, that's just me. Other patients won't wake up. You'll make sure like they have enough.
Uh-huh.
Yeah, and it's
Yes.
okay. All right. So yan, light sedation, and of course you do the workup on the patient. You consider everything before that.
Mm-hmm.
So you as the doctor will hear the sound. The patient will be sedated, and then it's basically really the sound waves. There's kind of like shock waves in a way. Will
Uh-huh.
really, it's focused on that point where the stone is.
Yes.
Okay.
Yes. Oh,
Um.
so yung principle nun is it enters the stone, the sound waves. It forms some bubbles. It forms bubbles on the stone. So slowly it pushes the stone, yung outward, and then it boom bursts.
Bursts. Okay.
Yan, yan.
So it
Yeah.
disintegrates. You end up pulverizing.
Well,
Yeah.
that's what we're hoping for.
That's what they're hoping for. Okay. Are there any like well, what type of patient would who has kidney stones kind of like qualifies for this treatment? Are there patients with certain types of kidney stones or conditions that you would say I don't recommend ESWL?
WL? Yeah. Okay. So definitely if you have bleeding tendencies, you cannot undergo shockwave.
Okay.
Or if there is yung something wrong with your anatomy,
okay.
right? You have to correct the anatomy first, then you take the stone out.
Mhm.
Okay. Now, if the stone is too big,
Mhm.
usually our size, it should be less than 1 inch.
Less than
Okay.
1 inch. Okay.
And of course, if the stone is not as hard,
Mhm.
yung density of the stone, you can easily get that in the CT scan.
Okay.
You would know how hard or soft the stone is.
Mhm.
Sa CT scan, they will tell you there's something we're looking for, yung HU, yung Hounsfield unit. It will tell you how hard the stone is or how soft the stone is. Normally, we want it less than 1,000 HU.
So
that means it's soft enough. It's soft enough for you to actually break it.
Okay. So if the stone is too hard, you wouldn't recommend it because you wouldn't know if it could actually break it.
Yes.
Okay.
If the patient still wants it, you just have to tell them in advance, look, it's we don't know how hard it is. We have an idea of how hard it might fail the first time around.
Yes.
We might need a second treatment. And if nothing happens after the second treatment, forget about it. It's not going to break.
Yeah. I was going to ask you, like, if it, after, okay, so I'm kind of jumping ahead, but like, how does someone prepare for it, for the ESWL, and then what do they expect after when it comes to like follow-up checkups or like you mentioned, you might have to do it again. Are there cases where okay, all right.
Okay. So of course, if the patient's like 40 years old or older, ako personally, I always refer them to a cardiologist. Kasi we're going to give anesthesia.
Yeah.
So we want to know if the heart can take it. Right? And then afterwards, after doing the procedure, first thing that we need to tell the patient is when you pee, you're going to pee blood. As in, really bloody. Kasi bugbog yung kidney, but it's going to recover. That's why yung shock wave, we only have like a certain number of shocks that we can perform. Because beyond that, the chance of injury to the kidney is high. Na it might become a permanent injury.
Yes.
But before anything lower than that, medyo bugbog lang yung kidney, it will recover.
Yeah. I wanted to ask you, doctor, since it is shock waves, sound waves, and when you are in front of a speaker, you can feel it. I mean, I grew up around production and concerts and all of that, so that's I hate being in front of certain speakers because I feel it in my chest. When you set up,
exactly.
like, other people sometimes don't feel it, but I'm like, no, I'll just go there to the other speaker. Like I can't, I can hear it in my ears and I can kind of cover my ears, but there are things that you can feel it. Because sound is like, it comes from movement and there's pressure and so anyway, is there, you do consider that like, if someone's kidneys, like it might cause trauma to the kidneys in that sense. Like there might be a kidney injury. You're careful about that. Okay.
Now, if the patient has talagang high creatinine to start with, because they have what we call chronic kidney disease, you cannot give the full extent of the shock wave. You have to lessen the intensity because their kidneys damaged in the first place already.
Yes.
So you have to lower down. It might that the problem is it might be less effective. But but at least you're not damaging the kidney any further.
But if part of it disintegrates, is that already a victory? And then you can wait and do the rest. Yeah. Okay. So it's a very very useful and I mean awesome compared to just going straight to surgery. So like how often do you employ this technique? Quite
okay.
Say I'm here.
You're talking about how often can we repeat the procedure or how often do we use
both?
Okay.
How often do you use it and generally speaking, and then how often do you repeat the procedure?
Kasi we are pretty selective when it comes to patients, certain criteria, like the stone should be at not more than an inch big, tapos yung not more than 1,000 HU yung tigas, okay, and then no other precipitating factors. Here in Makati Med, we would do like 20 to 30. That's almost every day.
Yeah, wow.
Of doing procedure. Not me, from all of us. I wish sa akin lang yun. No, but not me. All urologists. Yeah. Okay. And then usually after 3 days, medyo recovered na yung stone. But some yung kidney. But some stones kasi medyo delayed yung pagkadurog niya. It seems like nothing happened, but after several days, it crumbles. So you want to wait for that also. To be on the safe side, we wait like 2 weeks.
2 weeks, okay, yeah.
For us to say nothing really happened, let's do it again. Or sometimes kasi, once you've pulverized it, it will take that long a period of time for them to actually go with the urine and the patient to pee it out.
And you'll tell the patient, do you send the patient home with medication? Of course, you tell them, hey, you're going to pee blood the first time.
Yeah. Yes.
So don't freak out. And then, does the patient pee more often? Do you make them pee more often at home? Do you give a certain protocol like medicine or like drink water, that kind of thing?
Yeah. Pretty standard is you give them medications to help pass out the stone, and then you ask them to drink a lot of water, like 2.5, 3 liters every day, para they would pee. The blood would easily be peed out, so you can easily recover. And you ask them to take the day off, that day off, and the following day. And then after 2 days, you ask them to do their usual activity na. Kasi you need the patient mobile.
Mobile,
You
okay.
need the patient moving around para the chance of them peeing out the stones is higher.
Mm-hmm. Yeah. Okay. Yeah. Thank you, doctor. So,
And then, you also tell them na if the patient develops pain or fever to let me know agad.
Let you know.
Kasi that's not supposed to happen.
Okay.
Yeah.
So, does the patient or do some patients experience just a little bit of discomfort after the surgery?
Yes.
Yes. Okay.
Bugbog.
Bugbog.
They feel sore.
They feel sore.
They feel sore, definitely.
In that area only.
But it's not.
It's
but
not
most of them, it's not even enough to even take pain medication.
It's not enough to complain, and it's probably better than putting the stone there for a lot of people.
Yeah.
Okay. And then, so you've taken us through the steps of what typically happens, the preparation, the follow-up. Oh yeah. Do they how often do they have to come back for follow-up checkups? First you want them mobile after, you know, one day, and then like when do they come to you, and how do you conduct the checkups to see if the stone is still there?
Usually after 2 weeks, you ask them to come back with a repeat ultrasound.
Okay.
And yung as needed, yung urinalysis, CBC and creatinine, that's only needed as needed. But the ultrasound, that is what you need to do. Otherwise, you have nothing to talk about.
Yeah. And the ultrasound, of course, is just like, I always describe it this way. Any kind of type of ultrasound is, it feels like a roll-on deodorant thing, and then they just like move it around and they can see there. So that's it. Doctor, is there anything you wanted to say? You said that there are other techniques you employ also to just
kasi if the stone is in the ureter, if the stone is in the bladder, urinary bladder, it's difficult to do the shock wave.
Okay.
So we have yung pneumatic, yun yung parang what do you call this, the jackhammer type. It's it's a steel bar, tapos yung air pumps the steel to destroy the stone. That's what we have also.
It's non-invasive also.
Yeah, well, it's a bit more invasive than the shockwave, kasi you need to insert something sa penis or sa urethra, sa urethra ng female, no? There's a special camera that can look at the bladder, look at the stone, and then slowly yung blast it while seeing it. And definitely you can get it at one go. And then if it's in the ureter lang, we have a special instrument, long and small, that we can scoop out the stone. But if the stone is big enough, we can like do laser.
Laser.
Yun talaga, light yun.
Light. Okay.
A light that pulverizes the stone. And if it's in the kidney, we have this PCNL naman. Ito yung more invasive, kasi we puncture a small hole, this bigger hole on your back as a skin into the kidney, and we get the stone from there.
But it's still better than getting cut wide open and all that. And
most definitely.
Protocols. Okay, doctor, I'm told that we're running out of time. Is there anything you want to say to people who have kidney stones or who might suspect they have kidney stones, and maybe just your advice and about prevention of kidney stones?
Okay. Us in medical field, we always tell our patients prevention will always be better than cure. So how do you prevent this? Just drink a lot of water, 2.5 liters of water every day. Be more active physically, and try to stay away from mga food that's not really good for you. And yung regular checkup, annual lang naman, once a year. You don't need to see your doctors every day. It's just once a year. Urinalysis and ultrasound for me will be more than enough. It will give me a lot of information.
Doctor, I will send someone to you soon So if you
Yeah,
don't,
sure.
you could, I think I still have your number. But
Uh-huh.
not, I'll ask the team for it if you
Yeah.
don't mind. And it would be so
No
nice
problem.
to catch up with you also off the air. Thank you very much for your
Yeah.
time. Is there anyone you'd like to say hi to before we go? Anyone you'd like to greet or say hello to?
I'm good. I'm good. Thank you for the Makati Med family for thank you for Makati Med family for always being very supportive of the urology section. I mean, we owe them a lot talagang in terms of yung mga promotion.
With expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the